Hello, everybody. Welcome to Medicine and Science on the Pod TV network. I'm Nick Palavita. I will be your host today about a very important topic that comes from the World Health Organization. And no, this topic isn't the 37,000 people that died in Gaza or the 50, 60,000 people that died in Ukraine. Instead, this is a lot more deaths. Unbelievable. The media just doesn't report. I don't know why. But how about this? Measles killed last year 136,000 children. And we need to know why there was a huge amount of deaths. And by the way, you can look all this up. It's on the internet. 136,000 children. We don't know why they died, who killed them, what's going on here. And I thought measles wasn't a problem because I heard no one dies of it. There was a group called Physicians for Informed Consent say, hey, if you get the measles, you're not going to die. But then 136,000 kids died. So it doesn't make any sense. So to make sense of the senseless, we're going to bring in our resident medical doctor who's board certified in internal medicine, Dr. Michael Patmos, to give us an update as what's happening here. So take it away. Michael, 136,000 people died.
I'm doing good morning, Nick. Thank you for inviting me. And thank you to your audience for giving me a couple precious minutes to spend some time with you. I'm a board-certified internal medicine doctor with added qualifications in infection control and hospital epidemiology. So this topic is a subject of interest for me and one for which I have some expertise. And I really think the topic you have suggested today is, why did 136,000 children die of measles around the world in last year? So, and I will address that. Before we get to that, though, I just want to clear up a couple of pieces of misinformation that are floating around. The first one, and we heard this on a podcast the other day, is that viruses only mutate to less virulent forms as they mutate. That is absolutely untrue. The classic example of that is influenza. Some years influenza is more lethal, some years it's less lethal. The Spanish flu of 1918 was a variant, a mutant of influenza that was incredibly lethal. So viruses will mutate in both directions. They can be less virulent, more virulent, or the same, because mutations drive variants and mutations are random. So a mutation may just random chance confer less virulence or more virulence. So the idea that viruses only become less virulent over time is absolutely false. That was promulgated by some of the false, fake expert doctors you see on Fox News. That is not true. The second thing I want to mention is about there's always this criticism of there was miscommunication and poor communication. There is some truth to that. This was a new and evolving situation, and we're making up the rules as we go. Sometimes things change day by day. That's the nature of medicine. And different countries have different philosophies. So there was confusion and a lack of coordination. That's precisely why the World Health Organization is trying now to standardize pandemic response around the world, so make it more coordinated and more effective. Unfortunately, the GOP is dead set against this. They call it, and as part of their anti-globalism mentality, is to not allow any standardization of pandemic response. So they criticize the fact that there was poor coordination of communication, but then when there's the effort to try to improve it, they reject that. And the last thing, of course, is the notion that masks and social distancing and lockdowns didn't do anything. Masks don't work. That is not true. There is excellent retrospective data. Masks do work. They're not 100%. Nothing is 100%, but masks do work. And social distancing works. These are bedrock concepts in the field of infection control. So anyone who suggests that those strategies that were employed early on in the COVID pandemic were excessive or extreme, they don't understand infection control. All right. Now that I cleared up a couple of those myths floating around, let's get to your question. Yes, last year, 136,000, mostly children, died from measles around the world. How can that be? Now, I don't think we had any deaths in the United States, but we're seeing a resurgence of measles now in the United States. The simple answer to the question is, why did so many children die of measles last year around the world? It's because the measles immunization, only about 86% of the world's population has had any immunization, and that's one shot. It takes two shots to get coverage, and we've got to get more than 86% of the world's population. So the deaths occur in pockets, in locations, mostly third world countries, where access to healthcare is limited. There isn't anybody to give injections. It's hard to get vaccines out to some of these locations. We did it, however, with smallpox, but it's been a challenge. And what has made it worse is there's been a decline in vaccination rates around the world. It's so alarming that the World Health Organization named the anti-vax movement responsible for this decline in immunization as one of the top 10 threats to global public health, right up there with war, famine, and drought. So just ponder that. You have these top 10 global threats to health: war, famine, drought, and the anti-vax movement. So yes, the anti-vax movement is very much responsible for the decline in vaccination rates around the world. And it's been very significant. All over the world, vaccination rates are declining, especially in the United States. But we're seeing it everywhere because people are becoming afraid to take vaccines. And as the World Health Organization pointed out, it's organizations like Children's Health Defense, run by Robert F. Kennedy, that is promoting this anti-vaccine mentality. It was very noteworthy that Robert F. Kennedy visited Samoa a few years ago, made a big splash there about measles vaccine and autism. Measles vaccination rate in Samoa plummeted, and within a short period of time, measles was resurgent, and 15,000 or so Samoan children died of measles because of Robert Kennedy. And he quickly got away from Samoa. I don't think he's going back there anytime soon. So what we're seeing around the world is a resurgence of infectious diseases, an increase in death rates due to a decline in vaccination. The decline in vaccination is being prompted by right-wing politicians in alignment with the anti-vax movement. They are married, they're joined at the hip, these two entities. Interestingly, another interesting statistic from the World Health Organization, between 2020 and 2026, just in the last few years, it's estimated that about 57 million, maybe it was 2000 to 2025 or 24. In this century, the last quarter century or so, about 57 million lives have been saved by measles immunization. But, that's great. We're saving a lot of lives, but we're still losing over 100,000 a year unnecessarily. Let me make this clear. If you're immunized against measles, your chance of dying from measles is negligible. I mean, it is almost infinitesimal. Not 100%, but 99.9% you will not die of measles if you're immunized. Why on earth anyone would argue against measles immunization is unbelievably ignorant. The fact that we have a Surgeon General in Florida who says, don't worry about it. You can, if you get exposed and you're unable, just go out. It's okay. You can go to school. This is unconscionable. These folks are, and I think it's not just because they're ignorant. I think they're doing it for political purposes. So anyhow, that's basically my comments for today. And I would urge and implore people to question what they're hearing in social media, especially on Fox News, from experts when they haven't told you what their credentials are. They don't vet these experts. They don't check their credentials. I do. And I also check their background checks. And I can tell you that many of these fake experts just 5-6 years ago were broke, couldn't even make their tractor payments. And now they have a net worth in multiple millions of dollars. So there's money to be made being an anti-vax expert. You can get on TV, you can do all kinds of stuff. The public needs to be skeptical. Who is this doctor that's giving me advice? Are they really trained in infectious diseases, or do they just have 1 year of internship, or maybe no internship at all? So with that, I'm going to shut up and take comments and questions and facilitate some discussion.
Well, you mentioned Florida, and its Surgeon General, Joseph Ladopo, who's a liar, who claims to have experience and expertise in COVID at UCLA. When UCLA was contacted, no, he did not. And if you compare the post-vaccine availability death rate, that is after April 2021, when the vaccine was generally available across America, if you compare California's COVID death rate to Florida's COVID death rate, Florida's rate is 220% of Californians, which means if Florida had followed the same procedures and attitudes and practices of California, 60,000 Floridians wouldn't have died.
That is absolutely correct. The adjusted mortality rate per worldometers, the adjusted mortality rate in Florida for COVID is 4,430 deaths per million. That is 300% higher than the best performing state, which is Hawaii, my state. So yes, absolutely. Florida is the seventh worst mortality overall, mortality rate overall in the United States. And the United States had the worst mortality rate in the world. So Florida stands out as being one of the worst managed locations for COVID. You're absolutely right, Rick. Tens of thousands of people died in Florida unnecessarily because they didn't get immunized. And they didn't get immunized because they have a governor and a state surgeon general who are anti-vaxxers. They killed their own state residents.
And not just a few people. The people, you could fill a medium-sized city with the Floridians who died unnecessarily. Medium-sized town, 60,000 people. You know, a football stadium.
Right. Yeah. On a national scale, 1.5 million, 1.2 million people, Americans, and that's an underestimate, by the way. Yeah. 1.2 million Americans died of COVID, and about 300,000 to 400,000 of those deaths were preventable had they been vaccinated. So this is not inconsequential. I mean, when you think about, let's compare some numbers here. The Vietnam War, we lost 55,000 people. We lost 300,000 to 400,000 Americans unnecessarily due to unwillingness to be vaccinated. Florida had over 95,000 people die of COVID. That's nearly twice what we lost in the Vietnam War. So these are gigantic numbers. Here's another statistic for you. More Americans died of COVID than all battlefield casualties in every war the United States has ever fought, including the Revolutionary War. And just put that in, just ponder that.
Yeah, 410,000 Americans died on the battlefield in World War II. The worst war for Americans was Civil War, about 750,000. But you add up all our wars, and yeah, COVID killed more
yes,
Americans.
And it's astonishing to me that people don't know these numbers. I get into discussions all the time with people from Florida who say, no, Florida handled it great. It's the only one who thinks that Florida handled it great is DeSantis. Nobody else thinks Florida handled it great, but people take at face value because they're politically aligned. So whatever they say, they believe.
And measles is
you made some interesting statements, and one of them is this: social distancing works. Okay. I think empirical evidence shows it does work.
Yes.
Okay, because if you look at it, you're in Hawaii, I'm in North Carolina. There's a good chance that I will, if you have some disease out there, I won't catch it. So social distancing on the extremes work. The only question is how far apart do you have to be? Right. But the premise itself is empirically correct. So when people say, well, it doesn't work, I think they're complete idiots. How can it not work? The other thing is mask. Yes. Yeah, go on. I mean, I just don't see this.
It's a bedrock concept of infection control. Right. It's part of the infection control standard curriculum. There's no question that the spread of contagious infectious diseases declines as a function of the distance. If I'm 10 miles away from you and you cough, I'm not going to get what you have. So clearly, distance plays a role.
I just when I saw people saying it doesn't work, I said, your IQ has to be well below 80 to believe that, seriously, because anybody who has an IQ over 80 should say, of course it works. The only question is what distance. The other thing is masks do work. I agree with that one also. First of all, as you know, all medical doctors, they wear masks when they go into surgery. My mother, who was a head nurse at Tampa General, she always believed in, because when she was in surgery, sterile fields. I mean, it was a big thing, and to wear a mask. And so when they say the masks don't work, I was going, what are you talking about? Of course it works. Again, I think we have a problem in the United States. Half the population has IQs under 100. You know, what percentage? I don't know, maybe Rick does because he follows the testing.
Well, okay, so I can talk about that. So the average, well, anytime you talk about the average IQ of an entire country, you're embracing a creepy agenda, because most of the people who like to say, well, this country has a high, yeah, those people are racists. But you can say things like, you know, the average IQ of people walking around, you know, down the street might be like 106, because all the people with IQs under 60, they're not walking down the street. They are in an institution someplace. So that raises the average of people on the street.
Yeah. Yeah. And so the thing is, I think what we have, Dr. Patton, is there's a group of people who have a hard time, seriously. Their mental faculties aren't strong enough to comprehend whatever we're talking about, which to some of us is simple. I'm going like, this is real easy. When I played chess, you know, I won 3 Florida State championships. I look at the board, it looks easy. But I watched other people, they struggle with how the pieces move. And it just,
so there are industries and charities who prey on people with like early cognitive decline. Maybe 20% of the US consists of seniors, people 65 and over. And a lot of those people are still in charge of their own affairs, but into their late 70s, 80s, you know, their judgment declines, and their ability to, we saw it with my mother-in-law. Somebody tried to sell her, you know, they like, you know, when you get trash calls, they want to hear an old voice on the phone, because that means it's somebody easier to fool. And you look at Fox News with, you know, bright colors, super pretty ladies, super masculine looking, beefy, square-headed guys. Their target is people with, you know, who are less able to think than, you know, a lot of other people.
Yeah. And one thing I think you said very important, Dr. Patton, is, and I'm going to put it out there, do not get your medical advice from Fox. I mean, if you look at, that would be the last group of people I would look at to get medical advice, would be some group that has been sued and declared to be an entertainment company, not even an educational company, and they've lost judgments over $750 million. Why would anyone get their medical advice from Fox? It's not and the people that put on are really bad. Speaking of really bad, your friend Donald Trump, okay, just a little aside here. When he hired Michael Cohen graduated from the bottom law school in the United States, Thomas Cooley. And his next guy that came up who lost the case for him, we got criminally convicted, graduated from Brooklyn Law School, which doesn't even crack the top 100. They have a tendency to hire and bring in the bottom of the bottom, which if you graduate from a top 100 law school, you're going, you know, the only reason you go to those schools is you can't get in any other school. I mean, your LSAT GPA has to be absolutely horrible. And that's who he hires. And so I agree, you got to look at the credentials and who are these people that are making these statements. And I did look at them, and Dr. Patton, I must admit, with the anti-vaccine group, I'm not impressed. But go on, Counselor.
You both have made such an important point. I just want to take a minute to elaborate on it. It's really, really important for viewers to know that there have been a number of experts put on Fox News. They're kind of like perennially there. They're frequent visitors to Fox News on many programs. Sean Hannity, Laura Ingraham, the other guy, Tucker Carlson, who's no longer on Fox News. They had the same guests over and over again. And they tell the audience that these guests are experts. One of them claims to be the world's authority on the vaccine, on COVID vaccination. And that's how he's presented. And another one, a professor at Stanford, is a professor of economics, doesn't even have an internship, but presented to the public as an expert. Another one is a surgeon, very qualified surgeon, but he's not an infectious disease doctor. He's a surgeon. They don't explain who these doctors are and exactly what their credentials are or are not. And the reality is none of the doctors that Fox News has presented as experts in COVID and COVID vaccination are actually experts. They don't even have the minimum qualifications. They're not infectious disease doctors. They're not trained in infection control. Some of them never finished a residency. At least one of them never even did an internship. And they're being presented as experts. And the public assumes that if a Fox News puts a doctor on and said, this guy is the world's authority, that they've actually checked it out and that he is. Well, they haven't. I have. I've checked the resumes of all of these experts as well as their personal background checks. And I can tell you they are largely, if not totally, frauds.
Right.
So we talked about measles, but and which is the most communicable and I guess the most dangerous of the childhood diseases. But there's also mumps, and harder to get mumps. But the U.S. began a mumps vaccine program in 1967, and for 40 years, the instances of mumps declined, but they've been increasing since 2006, which I'm sure is because of anti-vaxxers.
Yes. The decline in vaccine, even the World Health Organization has observed that there's been a significant decline in vaccination all across the world. Some of it is due to logistics. Some of it is just due to difficulty getting vaccines to remote parts of the world. But a significant part of it is due to the anti-vax movement. It's a global effort. The Children's Health Defense Organization, which is run by Robert F. Kennedy, is a globally powerful organization, is actively advocating against immunization across the board, not just measles or mumps or rubella, but all vaccinations. And they do so, very disturbingly, they do so with very specific language targeted to the audience. They use different rhetoric when speaking to third world countries than they do when speaking to Black Americans, than they do when speaking to white Americans. They target the messaging based upon the ethnicity and the racial background of the audience. It's particularly heinous. It's actually a form of racism when you think about it. To use race and racial rhetoric to frighten someone against taking a vaccine, that's in healthcare, we talk about race-based healthcare disparities, the fact that certain races, certain ethnicities have worse outcomes than others. This is the quintessential example of that, using targeted language to discourage a specific ethnicity or racial group from being vaccinated. How is that not racist?
I consider RFK Jr. a very unsavory guy. This is a guy who's been addicted to heroin, who currently seems to be abusing testosterone, but somehow he's okay with sticking those needles into himself, but not vax needles. And one more thing is he's on his third wife. When he was married to his second wife, he kept a diary which included all his extracurricular sexual encounters, 37 encounters in just 1 year, ranked from 1 to 10, with 1 is just flirting and 10 is sex. His second wife found the sex diary and hanged herself, committed suicide. I'm sure she had other issues besides the sex diary, but this is the guy who's running for president, and he's just not a good guy.
It's the best and the brightest. But where should people go? Because we know where not to go. I mean, I wouldn't go to Fox, but where should people go to look for medical research and medical advice? Where can a normal layman go to?
Well, I can tell you where you shouldn't go. Forget the media, the mass media, and forget social media. Fox News is not reliable. In fact, Dr. Fauci just published a book yesterday, and he talked about in a recent interview, he said that when he was working for Trump, Trump got all crazy about hydroxychloroquine. And where did he get the idea from? From Laura Ingraham. So, I mean, you got presidents taking information from Fox News and spreading it around the country as fact. So you can't get it from the mass media. You can't get it from social media. So where should the average person go? hopefully your doctor, provided that your doctor is getting information from the right place. We have a lot of doctors nowadays, unfortunately, who don't, they're getting information from wrong places. So if you're a physician and you want to know about infection issues, you go to the Infectious Disease Society of America, IDSA, Infectious Disease Society of America. Their website is open to the public. They've got all these guidelines vetted, research is analyzed, critiqued, and the bad research is thrown out, good research is kept. Infectious Disease Society of America website is excellent. The CDC website is excellent, a little bit dense and hard to get through, but it's packed with information. And for physicians, if you're not using UpToDate, you are not up to date. The pace with which medical information changes is so rapid. Literally, it can change by the day. We saw that during COVID. We were changing recommendations all the time because the information changes by the day. How can you keep up if you're a doctor? Only one way. You've got to use UpToDate. UpToDate is the only tool that's updated with new information in real time. Literally, if something changed yesterday, it'll be reflected in UpToDate today. It's updated almost essentially in real time. And so that's the tool that doctors use. If you're a patient, ask your doctor, hey, doc, do you use UpToDate?
So if you're still wondering about COVID, because we're not out of the COVID woods, and you want to know, do I need to mask up when I go to the gym? And there's not a lot of testing going on, but there's still one reliable way to see what's happening with COVID rates, and that's poop water, wastewater, because they scoop up some water at the sewage treatment plant and they see how much COVID is in the and so if you can just Google COVID wastewater, include the name of your state, and you will see the curves. Like back in April, COVID rates got to be about as low as they've ever been. And I was super excited, that maybe I can just lose the mask altogether. But since then in California, COVID wastewater rates have tripled or quadrupled. And so if you want to track it to see how careful you might want to be, wastewater.
I still practice medicine. Every day I see a few, even though I'm sort of semi-retired, every day I still see a few patients. I'm still seeing COVID every single day. And some of them are pretty sick.
Wow. And another question I have is two areas I look at is the Mayo Clinic and the National Institute of Health. What do you think about those two organizations?
Yeah. Any of the major academic medical centers, Beth Israel Deaconess Medical Center in Boston, Massachusetts General Hospital, Johns Hopkins, Mayo Clinic, UCSF in San Francisco, Stanford. All these major academic medical centers are bastions of correct information. And they all have websites. And on those websites, there's information for the lay public. Go to a trusted source like the Mayo Clinic or Beth Israel Deaconess Medical Center in Boston. Get your information from the top docs, not some bottom dweller who no one ever heard of, who couldn't pay his bills and didn't even finish a residency and is now on Fox News and supposedly an expert. That's just not possible.
Yeah, I agree with you. And I think that's one of the big problems is that people are going to the wrong sources for their information when it comes to medical advice. So the CDC, the NIH, the Mayo Clinic, those are the ones I check out. And what I hate to say it, I don't check out Fox News. So I have no idea what they're saying. Laura Ingraham actually did graduate from UVA with which is a good law school. And she also became an attorney, but apparently when I listened to her speak on other topics outside of this, she's like way off in left field. And
just look at her net worth. Just look at her net worth. These people are making a fortune.
She's probably doing pretty good financially.
This is a great way to get rich.
Yeah, it's just really crazy. But we want to inform our audience to look at the primary sources in terms of tax law. When I practice, the first thing I look at, the Internal Revenue Code. In other words, look at the code, the regs, and then look at other people's opinions. But unfortunately, we're out of time, and hopefully we're able to help our audience. We'd like to thank Dr. Patmos and our viewers in the United States and around the world who tune in every week to Medicine and Science. We'll see you next week. Bye-bye.
Thank you.